Thank you very much, Mr. Chairman. I want to start by recognizing how unfortunate that this is such an urgent meeting that we're having. You know, in 2025, CDC reported an estimated 72,000 deaths from overdose. You think about that for a minute, 72,000 people's souls lost. You know, it highlights the brokenness of our system. I think we can fix this. I think the bills before us today represent some real and concrete solutions to address a crisis that has claimed more American lives than any war in modern history. Fentanyl alone accounts for an estimated 45,000 deaths in 2025. And that threat is not static, it's evolving, it's changing, as we've discussed today. It's almost faster than our regulatory framework can track. And I'm aware that there's many problems that cause this, but I want to focus on the sort of upstream sources right now. Now, and this is not just a domestic public health problem, this is a national security issue, and it has a return address. The Chinese Communist Party has subsidized and incentivized the chemical companies in their country to export fentanyl and all these other related precursors to produce synthetic opioids and whatnot that are illicitly sold in the United States. And I don't think this is negligence, this is policy. When China banned fentanyl production in 2019, they pivoted to selling precursor chemicals that are needed to manufacture. And when we schedule those precursors, they shift again. This is an adversarial biotech competition, and we're playing with a losing defense. I want to remind everybody we're supposed to renew the Pandemic and All Hazards Preparedness Act this year. Obviously, fentanyl is not the whole story. Nitazines and whatnot are, we've detailed today. Xylazine, my gosh, it's almost unthinkable, all the new sources of problems. These novel substances are outpacing our scheduling process. And legislation before us today, scheduling emerging substances, restricting pill presses, which I'm very proud to co-sponsor, are closing some of these loopholes. And I believe this is a layered response that this threat demands. Sheriff Lima, counterfeit pill presses look like legitimate pharmaceuticals. They make counterfeit pills look like legitimate pharmaceuticals, and they're a major cause for overdose deaths among young people, especially. I'm a co-sponsor of Addison McDowell's PRESS Act. From your perspective in law enforcement, does this bill close the right gap?
I think the bill does close the gap. If we look at the overprescribing of legitimate pills and to be able to buy online and have shipped to you a pill that looks exactly like the pill that was pharmaceutical grade, has created deadly consequences for many people across this country. And I think that getting this passed would have a tremendous positive effect on this country.
Thank you very much for that. Mr. Alton, the Chinese Communist Party has repeatedly made scheduling concessions under diplomatic pressure, scheduling fentanyl in 2019 and nitazines more recently. But each time the Chinese chemical companies pivot to unscheduled analogs or precursors, is our scheduling-based regulatory model structurally capable of defeating this problem with chemical and pharmaceutical industry capacity, or are we playing whack-a-mole?
Thank you for your question. I'd start with an analogy. To me, it's like boxing. We're getting punched in the face 5 times, and then we duck. That's what we're dealing with here. So I think speed absolutely matters. We are not legislating fast enough. We cannot keep up with it. So we need to throw every tool in our toolbox at it to be able to deal with this threat. They're an adversary that is incredibly hard to beat because they have the money, the funding, and they move faster than we do.
So if we do this by class as opposed to by chemical compound, I think we're a lot better off. Sheriff Lima, intelligence suggests that Chinese criminal networks are increasingly coordinating directly with Mexican cartels on precursor supply and finished product distribution. What does that convergence look like from a local law enforcement standpoint, and what federal authorities and resources are urgently needed by you?
We have a great relationship with the DEA. Terry Cole has assembled many members of law enforcement and policing at a local level to come together and to collaborate. We know the precursor chemicals came from China, and now Chinese chemists have taught the cartels, especially the two major cartels, the Jalisco New Generation and the Sinaloa cartel, to train from their chemists there. So it's an incredible problem, and the DEA and HIDA and other organizations are working with local, state law enforcement to ensure that we can deconflict and protect American citizens.
Thank you very much for your work. Mr. Chairman, my time has expired. I yield back.